Tai Chi is considered a way of moving. It is the practice of a graceful, slow moving exercise. The Yang form is typically done with slow, steady movements, which help practitioners to relax and feel the flow of energy within their bodies. The movements are large enough to foster a sense of exuberance and freedom. For a Yang style Tai Chi session, the participants will need a mat or a towel, and the environment should provide enough space for the participants to freely perform the movements. This could be in an indoor or outdoor setting. As the facilitator, it is important to go over and become familiar with these movements of Tai Chi before conducting the activity. It would help to print this and use it as a guide when facilitating the activity. This activity can be done individually or with a group of participants, but it is not recommended to have more than 20 individuals in a group. Before starting the activity, be sure to remind the participants that if at any point they feel uncomfortable with a pose or position, it is okay to take a break and pick back up when they feel ready. During the session, you will fluidly go through these movements of Tai Chi. Also, throughout and after the session, be sure to encourage the participants to stay hydrated and to take deep breaths. Some safety considerations would be to have the participants stretch before the activity, as well as keeping an eye out for proper form throughout the session. For an individual with a spinal cord injury, Tai Chi can be adapted to seated Tai Chi, where the focus is placed on the fluid movements of the upper body. According to Tai Chi for Health, this sitting form was designed to include shifting of weight while sitting, trunk rotation, upper limb joint mobilization, and muscle strengthening. The goal of the form was to try and counteract loss of strength in the lower limb and trunk muscles and unstable sitting imbalance. In the geriatric community, Tai Chi can be adapted to be a combination of standing and sitting. If the participant cannot be standing for prolonged periods of time, they can sit and continue the movements while seated and then stand when they're ready. And finally, for children with ADHD, the sessions could be adapted to be individual sessions and only indoors in order to avoid distractions. As a facilitator, it is important to keep a watchful eye and be sure that the participant is on task and going through the movements.